Now to Brazil, and Latin America is experiencing its worst ever recorded outbreak of dengue fever, a virus that's infected more than 1.4 million people in the region this year. The infection is spread by mosquitoes and affects almost every country in Central and South America. About 1 in 4 people infected will develop an illness, and in a small proportion of those, the illness will become severe and possibly fatal. The number of recorded cases this year is almost 3 times as many as that last year. Experts say climate change is partly to blame, with rising temperatures allowing mosquitoes to survive winter in larger numbers. Our next report takes us to Rio de Janeiro, where health workers are fighting an uphill battle to eliminate the mosquitoes' breeding grounds.
Ipanema Beach. In Rio de Janeiro, a late summer heat wave and over 90% humidity. Ideal conditions for the Egyptian tiger mosquito, which transmits one of the country's biggest health problems, dengue fever. Authorities estimate there are almost 2 million cases. That's led them to set up emergency centers across the country. This woman has come with her 6th son.
Where I live, there are many dengue hotspots. We have open water tanks in the area and lots of mosquitoes, so I think my son got infected.
Brazil is acutely vulnerable to the virus. There is a vaccine, but the state has to buy it from Japan at great cost. So far, only children and young people have been vaccinated.
We have enough vaccines for 25 million people in the next 5 years. That's just 13% of our population. We cannot contain the virus in our country like this.
The health department has sent workers to this favela. Hygienic conditions there are often difficult. Volunteers must explain that garbage that lies out to rot is an accelerant for dengue. The mosquitoes must not have access to standing water, because that is where they lay their eggs. A female can lay up to 90 eggs at a time, but without water, the eggs cannot develop into larvae.
If we don't want to get sick, we must take care of ourselves, because if there are mosquitoes here, the disease spreads to my neighbors and everywhere. That's why everything here has to be clean.
But some things are beyond the residents' control, like garbage, and mosquito breeding spots can show up in unexpected places.
There's a puddle of water in this car. I didn't find any larvae, but there could be mosquito eggs in there. You can't see them with the naked eye. I've put poison in it now.
Dengue isn't just a problem in poor neighborhoods. Mosquitoes are attracted to wealthier areas with gardens and pools as well. A neglected swimming pool, leftover water in plant pots, breeding grounds for the tiger mosquito. Pesticides would help, but can't be used everywhere. And that's what makes fighting the tiger mosquito so difficult.
Albert Coe is a professor of public health, epidemiology and medicine at the Yale Schools of Public Health and Medicine. Welcome to DW. What would you say are the most urgent measures Brazil needs to take right now?
Well, thank you very much for the invitation to be interviewed. The big problem is once epidemics start, prevention methods really tend not to be very effective. So the most important thing is getting people, especially those most vulnerable, to the severe complications of dengue, such as children and the elderly residing in impoverished communities, to get them to seek medical care and treatment to prevent those severe complications.
We heard in the report that, interestingly, this is not a problem that is restricted to poor areas, but are poor people affected more?
Yes, certainly, because of the uncollected refuse, and that serve as breeding sites for the mosquito, the Aedes aegypti mosquito that transmits dengue. We see largest burdens, not only of dengue, but other arbovirus or mosquito-borne diseases such as Zika and chikungunya in the poorest communities. And that's unfortunately the rule of thumb, that the poorest suffer most from these epidemics of dengue and other mosquito-borne diseases.
Okay, so How big a problem is it regarded generally amongst the population and indeed the government? Because I guess I was surprised to see in the report that people seem so relaxed about the idea of leaving water tanks open and pools neglected, where if the message was out there, you would think that, OK, we'll put a cover on it or we'll drain the pool.
Yeah, so certainly, there are ways to prevent dengue, and that's using vector control and reducing breeding sites. But what we've known, and this is the history over the last 30 years, with the increased urbanization, those traditional vector control methods have uniformly failed. And that's why we're really looking forward to new approaches, both to vector control. There's some novel strategies that are being developed at the moment, but also the use of vaccines.
Thank you so much for talking us through that, Professor. Professor Albert Coe from the Yale School of Public Health and Medicine.
Thank you very much.